Thanks God, the vaccines help to decline the number of the infected cases, especially when they started in Taiwan to do this. Of course, the vaccines doses, 3 doses of hepatitis shots, best protection, typically one shortly after birth, and then after 1 month, and then 6 months. All pregnant women should be screened against hepatitis B virus, because every 9 out of 10 infants will get hepatitis B infection if their mother are carrier or infected with hepatitis B virus, which means 90% vertical transmission. This is a very huge number. So we have to screen any pregnant female against hepatitis B virus to avoid these 90%, because the early infection of these infants will end up with early cirrhosis due to the compromised immunity of those infants. Also, the hepatitis A virus vaccine was developed in 1995. They are gotten in non-endemic places for 2 doses, especially for the children. And now in Egypt, it could be given in the early childhood with the hepatitis B virus vaccine. Also, we have the rubella virus number 6, which is spread by the cough and sneezing. Because it's a virus for a pregnant woman, it's very dangerous, because rubella is one of the torch infections, which means that when the pregnant lady get those infection, they transmit the infection to the baby intrauterine, and this could end up with the miscarriage or deformities for the young babies or children, like microcephaly or chorionitis or deafness. Those torch infection is standing T for toxoplasmosis, O for others like chlamydia, chickenpox, HIV, R for rubella, what we are talking about, and the C for the cytomegalovirus, and the H for the herpes simplex. So any pregnant lady should be screened for these infections, especially to avoid the transmission vertically to the newborn. And the rubella is one of those infections that should be evaluated, and there is a vaccine against this. Also, one of the important bacteria is the HIP, or the Haemophilus influenza type B. This is some serious danger for the children's immune system, and causes brain damage, hearing loss, and even death. Before having the vaccine, there was reported a very large number of infection rates in the young children, especially in the school, and the yellow bus for the rapid transmission of these bacteria, affecting the respiratory rate. And this is one of the most common causes of meningitis in children. Now, thanks God, we have a vaccine for the Haemophilus influenza type B, 4 doses at the first month and 4th month and 6 months, and then after the first 1.5 years. Also the measles, this is also a virus which was highly infectious. You could imagine how it's very contagious infection, that the measles could be very serious, especially for young children, because measles is a common in other parts of the world, unvaccinated. You could imagine that the measles has been even up to 2 hours stay in the room if one infected with the measles, and the measles virus could stay in the room for 2 hours after the person has left. So that's why it's very highly contagious. Now there is a vaccine for the measles in combination with the mumps and rubella. So it's called the MMR vaccine, measles, mumps, rubella, in 2 doses at 1 year or 1.5 years, and then the second dose at 4 years. Also, infants who are traveling to an endemic area below the 1 year could get one dose, but when they return back, they have to repeat the vaccine again. So measles, again, one of the highly contagious viruses in the children. And thanks God, we have MMR vaccine to protect against this. The whooping cough, the Bordetella pertussis, this is a bacteria which causes inflammation in the upper respiratory tract and the lower respiratory tract, which is causes edema and stenosis. And this sounds the whooping cough. That's why they call it the whooping cough, because of the breaking noise of the repeated cough. Of course, this is a life-threatening infection, especially in the young children. Now we got the vaccine for the pertussis with the DTaP, the diphtheria and tetanus, at the same time age as we mentioned. Also the pneumococcal infection. This is streptococcal pneumonia, one of the common causes of lung infection or even meningitis, and it's very dangerous for children. It is one of the capsulated bacteria, which is recommended for young children, and also in those who are planned to do or have to do splenectomy for any reason, because these capsulated organisms need the spleen to induce the protective antibodies against the vaccine. So before splenectomy, this is a remark, don't forget to give the vaccine of meningococcal meningitis, pneumococcal vaccine, and the Haemophilus influenza. One of those is the pneumococcal vaccine. It's the BCV13 at these time intervals. The rotavirus, this is one of the important virus, highly contagious, affecting the young children, causing severe diarrhea, and those infants could have morbidity or mortality due to the dehydration and deterioration of the general condition. There is now vaccine for the rotavirus in 2 doses, or 3, depends on the brand of the vaccine, I mean. Also, we have the mumps. This is the virus which causes hypertrophy in the parotid glands or the salivary glands. It's called swollen jaw, with fever and headache and muscle aches and tiredness. Also, the mumps is contagious disease. There is no treatment, and the vaccine could protect against the mumps in the MMR shots with the measles and rubella. Also, we have the chickenpox, which causes itchy rash of blisters and fever all over the body. And the chickenpox could even be life-threatening, especially in babies and weakened immune system persons. There is a vaccine for the chickenpox in 2 doses, one of them at 1 year and the second by 4 years. And finally is the diphtheria, this bacteria which cause infection of the throat or the upper part of the oropharynx. The diphtheria still exist, but we are not hearing about the diphtheria infection because of the DTaP vaccine as part of the vaccine which is invented to protect against the diphtheria infection. So all what we mentioned are infectious diseases which are highly contagious and could be lethal, especially in young children or for a pregnant lady. But they are start to disappear, or the rate of the case fatality or mortality are low because of the vaccine, the orientation of the infection, and the existence of vaccines to protect against their infection. There are also emerging infectious diseases, which are defined by outbreak of previously unknown disease, or it could be a known disease that are rapidly increased in the incidence or geographic range in the last two decades. It could be an old infection, but there is a new version or a new mode or a sudden increase in those strains. Or it could be persistence of infectious disease that cannot be controlled. Example for the emerging diseases is the HIV and the SARS and the Lyme and the E. coli by the Chiga toxins and the Hanta fever and the viral hemorrhagic viruses. I will now shift to a little bit way of historical movie to show you the timeline of previously infectious diseases, the 20 deadliest infectious diseases worldwide during the past decade. So we will start with these 20 infectious agents. We will start with the Antonian plague in 160 AD. Of course, it started in the Roman Empire, and due to troops returning back from the Middle East, and they caused 5 million deaths, around 1/3 of the Romanian population. And again, we have the Justinian plague, which affect the Romanian Empire again in the Mediterranean region. And this infection ends up with a large number of mortality in Europe. They killed almost half of the European population by that timeline, around 30 to 50 millions. Then we have the Japanese smallpox epidemic in Japan. This is a viral infection which killed 2 million, around 1/5 of the Japanese population. Then we have on the 17th place the Black Death, the bubonic plague. This is started in China and went to Europe and Africa. This is similar to the Justinian plague and caused by the Yersinia pestis bacteria. They end up by deaths of 25 millions, around 1/3 of the continent's population. Then we have on the 16th place the smallpox Aztecs disease or the Aztec pandemic. This is in Mexico. This is placed in Mexico, which came through the Spanish ships to Mexico. And it was one of the causes to the fall down of the Aztec Empire, at which 8 million have died from this pandemic. And in the 15th place, we have the Great Plague of London. It is the last plague happened in England, called bacteria, the flea, and then have Great Plague, which founds in Romania, Hungary, Ukraine, and they end up at death of 50,000. Also, we have the Vibrio cholera pandemic. This number of mortality could not be estimated by that time. Also, we have the plague of Romania, which end up with the large number of mortalities. Again, we have the yellow fever, which has started up from the Europe to Africa due to via the slave trade. We have around 150,000 mortality. This transmitted by mosquito infection as a vector. We will discuss this later. Also, we have got this the Russian flu. And this is the first flu pandemic in 1889 to 1890. It's end up by mortality of 1 million person worldwide, and then followed by the Spanish flu in the recent 100 years ago. Of course, they infected a quarter of the world population, and they end of around 17 to 50 millions of mortality worldwide. This was in the 1918 till 1920. And then we have the eighth pandemic is the Asian flu. Of course, this was in the East Asia, and then it's transmitted to the rest of the world by the 1957 to 1958. This ends up by 2 million worldwide mortalities. And some researchers said that this could be an extension for the Hong Kong flu, which happened later on, like 10 years after that, due to a mutation, exactly what happened with us with the SARS or COVID infection. So again, on the 7th place, we have the Hong Kong flu, which was an extension to the Asian flu, and it ends up with 1 million mortality. Then we have, after that, this is the Hong Kong, and 1 million mortality for the Hong Kong flu. Then we have got the HIV and the AIDS infection had first reported in the world due to the HIV infection and due to transmission from the chimpanzee to the human. It ends up to 30% mortality of the reported infected persons. And then we have on the 5th place the 2003 SARS infection in China. Of course, they started the virus through animal reservoir, mostly the bats, and then the bat transmitted to another animals as a secondary reservoir. And there is reported 8,000 reported infection. From them, there is a mortality of 770 deaths. Then we have on the 4th place the swine flu in 2009, or later on it transferred to the avian flu. Of course, it was in the Far East due to the mutation in the influenza virus H1N1, and it caused 150,000 reported mortality worldwide. And then in 2012, there was the Middle East coronavirus respiratory syndrome, or SARS. Of course, this was in the Kingdom of Saudi Arabia, where there was 2,000 infected cases reported and mortality of 860 cases. And in the 2nd place is the Ebola virus in 2014 till 2016. And this happened in the West Africa, and we will discuss this infection later on in details. Of course, the Ebola virus, they have reported this of 11,300 cases. And finally, in the 1st place, the last pandemic worldwide is the COVID-19 virus. As we mentioned, this is started in Yuan and transmitted to Europe and United States. And the last reported mortalities was around 13,000 cases from the infected reported cases. So these are the 20 deadliest pandemic happened in sequence from the period time after the Christ till now. And to know how is the deadly disease, what is the definition of the deadly disease, we have to differentiate between the mortality rate and the case fatality rate. The case fatality rate is calculated by the division of the number of deaths from a specific disease over a definite period of time by number of the individuals diagnosed with the disease during that time. The resulting ratio is then multiplied by 100 to yield the percentage. For example, if we have a population consists of 1,000 persons, and we have 300 of them infected with a specific disease. From these 300, we have 100 of them dead or reported death of this specific disease. So the mortality rate will be the 100 cases over the whole population at that time. So it's 10% mortality rate, but the case fatality rate is the number of cases, mortalities, divided by the number of the over the number of the infected population, which means 100 over the 300. In this case, the case fatality is 33%, which means if anyone get this infection, 30% or 33% of them will die. And accordingly, I started to prepare the rest of the lecture to mention the deadly infectious diseases. So we will start from in ascending manner, the case fatality of 0.1%. We have the common cold. This is the seasonal flu, one of the rhinoviruses. They have this is one of the infectious diseases. We have it every year, but the seasonal influenza infection or virus has a very limited case fatality rate. 2.2 is the parasitic infection cysticercosis. This is one of the neuro parasites caused by the Treponema or Tinea solium, one of the pork tapeworm. They affect the CNS, and they consider the most clinical important manifestation of the CNS. Excuse me? Yeah, do you hear me? There is any question?
Carry on.
Okay.
So it was just a glitch.
Okay. So the Tinea solium, these parasites are transmitted through the gut from the pork or the pig to the brain, and then it causes the cysticercosis. The case fatality rate is 2.2%. And then we have again the rotavirus. We spoke about this. This is one of the viruses that affect the young children, the intestinal wall, and it causes secretory diarrhea. And those childs are have a life-threatening condition due to the dehydration. And now we have vaccine for this. The case fatality rate is 2.4. And we have also the Haemophilus influenza infection. The type B, it's the Hep virus, which affects the trachea, upper respiratory tract, or the lungs and causes pneumonia, or the brain, which causes meningitis. Of course, there is the early diagnosis and treatment with antibiotic is very beneficial. And again, the vaccine is very protective among the young children. And the whooping cough, the Bordetella pertussis, the case fatality is 3.7%. And there is 2 types of vaccines recommended to protect against the whooping cough or the pertussis. The DTaP or the Tdap vaccine. It depends on the age group of the children. If they are not vaccinated and in teenagers, so they could take the Tdap vaccine. If they are very young, the early months, they could take the Tdap with the diphtheria and the tetanus. Also, we have the Shiga toxin. This is one of the Escherichia coli, E. coli producing Shiga toxin, which causes hemorrhagic colitis. It might be life-threatening and causes hemolytic uremic syndrome due to the renal affection. The case fatality is much higher compared to the previous organism, reach up to 5%. And 5.7 in the vial disease, it's the leptospirosis. Leptospirosis is a disease caused by spirochetes, is called the leptospira. And they causes a disease which called leptospirosis or leptospira ecthemorrhagica. Ect means actress due to the Johns, and hemorrhagica means hemorrhagic feature of the disease, which causes fever, Johns, renal failure and oliguria, hemorrhagic features, and CHOC syndrome. This is one of the most common zoonoses due to the poor sanitation or the agriculture or the and increasingly with the adventure sports. Now we have the COVID virus, COVID-19. The case fatality is 6.5%. As we know, this is started in 2019, December 2019, by the SARS-CoV coronavirus type 2 in Yuan in China, and the WHO declared it as a pandemic infection in 11th of March 2020. And all of us, we know that the common symptoms of or common presentation of the COVID infection. The point that the onset of symptoms over a period of time or of a week with a rapid progression to respiratory distress around day 5 to day 8. Severe conditions of the patients with COVID-19 have presented with septic shock, diabetic ketoacidosis, acute kidney injury, and acute cardiac injury or dysarrhythmias. Nowadays, we have 3 types of, or 3 forms of vaccines undergoing large-scale phase 3 clinical trials in the United States and the rest of the world. We have the messenger RNA vaccine, and we have the protein subunit vaccine and the vector vaccine. The initial results of these types of vaccines is showing efficacy, how effectiveness they are, ranging between 95 and 92%, down to 70%, but depends on the type of vaccine we are using in phase 3. And now we are talking about the Zika virus. The case fatality of the Zika is 8.3%. The Zika virus was first described in afebrile rhesus monkey in the Zika forest in Entebbe in Uganda, was reported in a human field working. And then currently the Zika virus is known to be widely distributed all over the world, even they reach to the Far East or in the Latin America. Of course, they need vector like the mosquito, and this virus is causing rash. It's self-limiting. The point when a pregnant lady got the infection with the Zika virus, they have high incidence to get microcephalic babies. So it's very dangerous during pregnancy. And we have, after that, the leprosy with case fatality 9%. Diphtheria, we spoke about it, 10%. Botulinum toxin in 10.5%. And monkeypox in 11%. Also, the SARS virus, which happened in 2002, 2003, the first one, which was the preceding virus before the COVID-19. Case fatality higher to the coronavirus, or COVID-19, 11.6%, 11.5%. The toxic shock syndrome caused by Staph aureus infection in 12%. Tularemia, this is the rapid fever, in 15%. Measles in 5.7% case fatality, highly contagious. This is one of the diseases we mentioned before, and thanks God we have a vaccine for this. The starred items in yellow, they are one of the hemorrhagic fevers, and we have to discuss them in details later on. So the first of them is the dengue virus. It's a mosquito-borne infection, one of the hemorrhagic viral fevers. Case mortality 22%, case fatality. And the tetanus is 25%. That's why the tetanus is protecting against tetanus Clostridium infection. The listeria, this is one of the common bacteria that affects the pregnant lady and causes severe diarrhea. Especially it could be fatal during pregnancy with case fatality of 30%. And typhoid fever with case fatality of 31%. We have also the MRSA infection, the methicillin-resistant Staph aureus. They have a case fatality of 32%. Smallpox infection, the first disease declared eradicated by the WHO in 1980s. This is cause of one of the, I mentioned, the pandemic I mentioned in the first part of the lecture in Japan. The case fatality is 33% if they are untreated. Again, this is a starred item. The case fatality is 36% in the hantavirus, one of the hemorrhagic viruses, hemorrhagic fevers. And the Middle East COVID virus infection, they have a very high case fatality. As we mentioned, it occurred in 2012 in Kingdom of Saudi Arabia, with very high rates of case fatality compared to the SARS 19, COVID-19 infection. As we see that the percentage is getting higher in the meningococcal meningitis, with case fatality 50%, and with Vibrio cholera infection, one of the worldwide pandemic, as we mentioned in India, with high rates of mortalities in 1817. Again, we have the yellow fever starred item, one of the hemorrhagic viruses, with case fatality of 56%. Bubonic plague with case fatality of 64%. We have also the Ebola virus, one of the recent worldwide pandemic in 2014 and 2016 in Western Africa, one of the hemorrhagic viruses infection. Again, the avian flu, case fatality of 70%, and this is one of the recent pandemics in the last 10 years. Tuberculosis, Mycobacterium tuberculosis, case fatality of 70%. Lassa virus, one of the hemorrhagic viral infection, we will discuss them, with case fatality 71%. And we have the Nipah virus and the Marburg virus with case fatality between 75 to 80%. We will discuss now these types of virus. We mentioned them with case fatality ranging between 50 to 80% or 90%. We have in the hemorrhagic fever viruses during the last decade, like two pandemic episodes, one of them for the Ebola. We have 4 viral families, the Filoviridae, and they included the Marburg virus and the Ebola. And we have the flaviviridi, and they included the yellow fever viruses and the dengue virus. And we have the Banya viridi. They included the Rift Valley fever virus and the Hanta virus. And finally, we have the Arenaviridi, and they include the Lassa fever virus. Of course, the names or the names of these fevers or infections or virus are related to the place where they found them. So Ebola is a place, and Marburg is a place, and yellow is the color of the virus, and the dengue and Rift Valley, all these are, most of them, places they named the virus according to this. So the flaviviridi, we will discuss the yellow fever and the dengue fever. Of course, they need the reservoir, which are the mosquito, and they are in a tropical region. So if you are plan to travel to a place where these mosquito exists, the Aedes mosquito could transfer this virus from one person to another. Then you have to get a vaccine against the hemorrhagic virus. Of course, the yellow virus, they have vaccine, but the dengue is not. The Arenaviridi, we have the Lassa virus in the West Africa. Of course, the reservoir is rodents, and they cause Lassa fever, which transmitted through body fluids and infection. We have example for the Binaviridi, the Congo Carmen hemorrhagic fever, and this is a place in Ukraine. This is an island, Crimea Island in Ukraine, where they found this virus at the very beginning with reservoir or vector transmission is the ticks. That's why they call it the Congo, because the disease transmitted from Congo and went to the Crimea Island there. The Rift Valley, this is in place in Africa, and they are transmitted with mosquito. And the Ebola, this is one of the highly contagious hemorrhagic viral infection, which could reach to 80%, as we mentioned, in some references mentioned up to 90%. And this is one of the viruses that could be transmitted from one person to another. They doesn't need a vector in the beginning. So that's why they are highly contagious. This is the place of the Crimea Island where the Congo Crimea virus occurred. Now we will discuss the Marburg and the Ebola virus. They are a flaviviridi, as we mentioned. This is the Marburg viron, and this is the Ebola. Their shape under the electron microscope. And why they cause hemorrhagic fever? Because the viral infection has been captured with the infected dendritic cells and the infected macrophages, and they will produce a lot of cytokines like the interleukin-8 and tissue necrotic factor alpha, which will induce more platelet aggregation and formation of fibrin clot. And this will increase the permeability of the body fluids through the membrane of the vessels or the artery, and this will end up with hemorrhagic manner of these viruses due to the damage of the vasculature of different organs, which will end up with multi-organ failure and causes death. The Ebola virus, first diagnosed in the Congo, there was a river which is called the Ebola River, and in this place exactly they found the first reported cases of this virus. That's why they call it Ebola virus. They are mostly presented in the sub-Saharan region, as we see here, in the middle part of Africa, but now it's widely spread to the Far East and India. Contact with animal reservoir, they could transmit this virus at the beginning, but human to human spread via contact with infected blood or secretions could transmit the Ebola virus. The last outbreak was in 2014 and 2016, as we mentioned, and it was in the Western Africa, in Sierra Leone and Guinea, Liberia, Senegal, and Mali in the United States. Most severe cause of viral hemorrhagic fever, this Ebola virus, and it presents with flu-like symptoms with maculopapular rash and hemorrhagic multiple sites of GIT and bleeding. Of course, the labs needs biosafety level 4 isolation to deal with this during diagnosis. We could do cultures for the virus, the Marburg or the Ebola virus, but we could rely on the molecular screening with the real-time PCR and immunoglobulins against the Ebola or Marburg viruses. Of course, there is no definitive management and there is no vaccine except for the, I'm sorry, there is no vaccines for the Ebola and the Marburg disease, only supportive treatment. Containment is the key. We have to protect those cases, and I've got very nice video I could show you to your display. The story of a young child in Africa telling her story of Ebola. Do you hear the sound?
This is the story of how my village survived Ebola. Bats brought the tiny Ebola germs, too small to see, so small, yet so dangerous. Without realizing, grandfather rubbed a little blood in his eye. Ebola germs came into his body. Days went by. Then grandfather got a terrible fever and weakness. We thought it was malaria, but he was soon much worse. He had vomiting and diarrhea. His fever got even higher. I ran to get the nurse. But grandfather had already died. I was heartbroken. The nurse thought it might be Ebola, a disease caught from bush meat, but which spreads from person to person. Others in our region had already died of this new disease. Unless we understood the disease and followed their rules, it could spread further and kill many more people. She explained that Ebola was in the body fluids of someone who was sick or had died of Ebola. Their sweat, tears, mucus, saliva, vomit, diarrhea, urine, breast milk, sexual fluids, and blood. When we touch a sick person's body fluids, the Ebola germs can get into small breaks in our skin or into our eyes, nose, or mouth. The Ebola germs spread into our body and make us sick. When somebody dies of Ebola, that body is much more contagious. No one should ever touch the dead body. The nurse advised us to wash our hands with soap and water right away. She contacted the trained burial team to help us bury grandfather's body safely. The burial team came. They comforted us and explained what they had to do to protect us. The team wore protective clothing that kept them safe from the dangerous germs. They sprayed grandfather's room and his body with chlorine to destroy the Ebola germs. They put his body safely away in a bag. To prevent the spread of Ebola, no one could touch the body of anyone who had died with signs of the disease. They also burned his mattress, bedding, and clothes, anything that might have his germs. All these actions made us safer. It was too great a risk to follow all our traditions, but we still honored grandfather in the time of Ebola. Our chief gathered all the villagers together after grandfather's death. He explained that it's natural for us to fear Ebola, but if we trust in our health workers and follow their rules, we could stop the disease. The nurse explained to us, when a person has symptoms such as fever, don't touch them. Get them to the treatment center right away. They will have the best chance of surviving and they won't spread Ebola. She advised us to wash our hands with soap and water many times a day. The whole village agreed to follow these rules. Since we all had close contact with grandfather, we were at risk of getting Ebola. We had to stay home. A health worker visited us every day to see whether we had fever or signs of sickness. We would show signs within 21 days if we had Ebola. Many days passed, and I thought we would all stay healthy. But one morning, I found my mother burning with fever. I knew I couldn't touch her. She was now contagious. My father came in. He told me he was taking my mother away to our uncle's house in the nearby village. He was afraid to take her to the treatment center, afraid he'd never see her again. I knew I had to stop them. I was young, but I stood up to both of them. I told them if this could be Ebola, she must go to the treatment center right away. We needed to trust in our health workers to save her, save ourselves, and save our village. I saw in their faces that they understood. Running away would only lead to more death and suffering. My mother tested positive for Ebola. They found her a bed. At first, the health workers looked scary, but I knew they wore the suits to protect themselves. And inside, they were normal people like the nurse. They took good care of my mother. They gave her fluids, medicine, and food, and helped her body stay strong to fight Ebola. I missed my mother very much, but I could still talk to her on the phone. Sadly, some people in my village didn't survive, but my mother got better day by day. Soon, we were able to see her from a safe distance. One day, the nurse announced that my mother would live. Now we were safe to hug and kiss her. It was a day to celebrate. Our village followed their rules. We trusted our health workers, brought us sick for care right away, called for the safe burial team when one of our people died, and we always wash our hands with soap and water. Our village survived Ebola. Yours can too.
So this was the story of the Ebola. I tried to summarize it because it's actually one of the highly lethal infections with no vaccines. And there was a recent outbreak. It was the last pandemic in 2014, 2016, as we mentioned. This is one type of the hemorrhagic fevers, and Ebola, one of the highly has a high rate of mortality of those hemorrhagic fevers. Back again to another types of hemorrhagic fevers, we have the yellow fever and the dengue fever. The yellow fever is the flaviviruses. They call it yellow fever because flavus in Latin or old Greek term, it's called yellow. That's why it's called the yellow fever. The virus, this virus has a vaccine nowadays. I was supposed to go to Western Africa to Cote d'Ivoire to give their lecture. And it's obligatory to get yellow fever vaccine. Of course, it's valid for 10 years, and others said it could be for a lifetime. I'm not allowed to leave the Egypt or the Egyptian airport without getting the yellow fever vaccine. And we have also the dengue fever, Viron. Both of them, they are virus. Of course, they need arthropod-borne or vector to be transmitted. Aedes aegypti mosquito, human and non-human primates reservoir. There could be like reservoir that could transfer this infection to a human, but at the end they need vector to transfer this infection to us, like the dengue fever and the yellow fever. They needs the Aedes mosquito here, and the reservoir, the jungle monkey. Of course, the places of the yellow fever occurs in Africa and in Latin or South America. This is the belt around the equator, north and below, for the zones of the dengue fever. Of course, it is one of the hemorrhagic fevers with the lower rate of case mortality compared to the Ebola, but it's still, they are highly lethal. Most begin with self-limiting, most benign and self-limiting. The yellow fever is one of them. Incubation period 3 to 6 days. Of course, the symptoms could be fever, chills, myalgia, back pain, severe headache. These virus could go to the spleen, liver, and the macrophage and causes damage to the endothelial system, and this causes the coagulopathy of the vital organs like in the CNS or the liver, and causes hemorrhage, and this is a life-threatening condition which end up with a multi-organ failure. For the dengue fever, there is another pathognomonic classic feature is the break-bone fever. This is another name for the dengue fever because they affect those patients affected with severe bone aches compared to the other hemorrhagic fevers. The diagnosis depends on the real-time PCR from the serum or CSF or by tissue PCR in the first 7 days. Also, we could rely on the ELISA for the immunoglobulin M or G for the detection of both viruses. Treatment is supportive care only. Yellow fever, they have vaccine, as we mentioned. This is a live vaccine. It's contraindicated to be given for immunocompromised persons, but it's very protective against the yellow fever. And one of the protective or preventive measures is to avoid the mosquito vector bites. The same thing like with malaria. We have another third group, the Rift Valley fever and the Hanta fever. They are from the group of the Bina viruses. Two most common of the herboviruses. They are RNA. This is the Rift Valley virus, and this is the Hanta virus particle. The Rift Valley arbovirus, they need reservoir like the cattle, buffalo, and sheep and goats. While the hantavirus, they not an arbovirus, they could transmit from the rodents directly, and that's why they cause the Hanta fever, and they named the fever with the name of these small mice. The Rift Valley occurs in the sub-Saharan Africa, in Kenya, Somalia, Tanzania, Saudi Arabia, and Yemen. While the Hanta, they have two different places, the Old World and the New World, those in the tropical area. The clinical feature, both of them, they are hemorrhagic fevers. They have the common symptoms like the other, but the hantavirus, they have a hantavirus pulmonary syndrome. They could affect more the lung with rapid progression to cough, shortness of breath, and pulmonary edema. Again, the diagnosis depends on the real-time PCR with ELISA, immunoglobulins, IgM, IgG. ELISA may be able to detect antigen in a very viremic patients, such as those infected with Rift Valley fever. We need a biosafety labs level 3 to 4. Supportive treatment is the only line of treatment for them. Rift Valley vaccine is not licensed commercially, and we need to do vector control for not the Hanta, but the Rift Valley. Finally, we have the Lassa fever. The Lassa fever has come from a group of the arenavirus. It's a Greek word for the arenosa, which is the sandy fever or sandy shaped virus and under the electron microscope. Of course, this is the reservoir, the small mice, similar to the Hanta fever. It occurs in the endemic area in the Western Africa. Transmitted with the rodent's urine dropping, and there is a person-to-person spread. It causes fever, sore throat, and retrosternal pain, facial swelling, and proteinuria, conjunctivitis, coagulopathy, and hemorrhagic presentation, and shock. High rate of death in the third trimester in the pregnant ladies, and varying degrees of deafness in approximately 1/3 of the infants. They need, again, biosafety labs level 3 to 4 precautions. Throat and urine specimens for isolation takes 7 to 4 days. ELISA for IgM, IgG, and real-time PCR. The treatment and prevention and control. There are supportive treatment with fluids, electrolytes, and oxygen. There is a limited antiviral rule for the ribavirin as an antiviral therapy for them. And prevention of rodents, control and trapping, and proper food storage are important preventive measures. I think this is the last two parts. We finished now the hemorrhagic fevers, the Marburg virus, 80% mortality. We will talk about the HIV and the anthrax. HIV mortality is 90%. Of course, all of us knows what's the HIV infection is the infection with the human immunodeficiency virus, but the disease is called AIDS. It's the acquired immunodeficiency disease due to the deficiency of CD4 cells and the T lymphocyte syndrome. And it came from the chimpanzee species to the human in Africa, and then it transmitted through the body fluids to from one person to another. This is an example to show the average number of HIV particles in 1 milliliter of these body fluids. If we found 1 milli of blood, they have the highest rate of viral particles, and this semen in lower than this. And the third place is the vaginal fluid, amniotic fluid, and finally in the saliva. That's why it's highly infectious with the blood products and sexually transmitted disease, and from the pregnant lady to her child. This is the main 3 causes of transmission of HIV infection. As we know that the HIV is have spikes to get adherent to the CD4 cell membrane, and that's why they decrease or disable the orchestra of the immune system, the CD4 cells, which give the immunomodulators to call for the other immune system, the cell-mediated or the humoral, to start to defense against viral, against any type of infection. When the HIV infection disabled those cells, those patients are more lean for different types of infection, whether they are opportunistic or not. This would happen after a latent clinical presentation, which could stay for years, when the CD4 cells, which occur here in dotted blue, go down, and the rate of infection could increase. The HIV viral load would increase. So the cell, when they decrease, there is a direct correlation with the AIDS syndrome, the acquired immunodeficiency, and opportunistic infection could take place in this time period, which leads to the death. And the CDC classified the stage of HIV depending on to the CD4 count, whether it's more than 500 or between 200 to 500 or less than 200 or lower than this. because at each count, those persons are more linked to a special type of infection. For example, when the count is more than 300 or 300 to 200 or 50 to 200 or less than 50, the CD4 cells, we will find that, for example, the tuberculosis, pneumococcal pneumonia, and candidiasis fungal infection occurs when the count is more than 300, or cervical dysplasia as well. When the count decreases to 200, between 200 and 350, herpes simplex and herpes zoster and thrush could be more in addition to the previously mentioned infection. When the count goes between 50 to 200, we will find another opportunistic infection like the pneumocystitis cranii or toxoplasma or the cryptococcus, meningitis or cryptococcus pneumonia. When it's dropped down to a lethal level, then those patients could suffer from CMV retinitis or Mycobacterium avium complex or cryptosporidiosis or the progressive multifocal leukoencephalopathy. And not only infectious agents, but as we know that the AIDS could be associated with some neoplastic infection, could be related to some viral infection with the herpes, like the Kaposi sarcoma or the Burkitt's lymphoma, or lymphoma or lymphoproliferative disorders. The last cases, we have the case 50 higher in the case fatalities with the rapes and disease due to the brine infection. This is the lecture. I tried to touch a lot of things. I hope that we covered most of the important things we need to mention, and I'm ready if there is any question. Hello?
Yes, sir, we are here.
So, there is any questions or concern regarding the lecture?
Not really, sir. It was very informative. Thank you for your time.
Okay, great. Great. So, thanks for the invitation, and we hope to meet another time and collaborate together in the future again.
For sure, sir. For sure.
Okay, great, great. Many thanks. Bye-bye.
Thank you, sir. Bye.
Thank you.
Thank you. Thank you very much. If there is no other questions, we can finish today's meeting if any student has the question or the professor.
No, I think we are done.
Thank you.
Yeah, I think
Thank
no
you.
one has the question. So thank you once again. Thank you very much.